দর্শক, আশা করি সকলে ভালো আছেন। আপনাদের সকলকে আমন্ত্রণ জানাচ্ছি ভেস্থানি ইন্টারন্যাশনাল হসপিটাল প্রেজেন্ট সুরক্ষায় প্রতিদিনের আজকের বিশেষ আয়োজনে। দর্শক, আমরা জানি যে আধুনিক সময়ের যে চিকিৎসা ব্যবস্থা আছে সেখানে রোবোটিক সার্জারি নিয়ে অনেক কথাবার্তা হচ্ছে। আমরা বিভিন্ন কঠিন অসুখ বিসুখে রোবোটিক সার্জারির প্রয়োগ নিয়ে কথা বলছি এবং এতদিন ধরে যে এই সার্জারিগুলো কঠিন ছিল সেখানে রোবোটিক সার্জারি অনেক নতুন সম্ভাবনার দ্বার উন্মোচন করেছে। আজকে আমরা ভীষণ আনন্দিত, আজকের এই আয়োজনে আমরা অত্যাধুনিক রোবোটিক সার্জারি নিয়ে কথা বলবো এবং এ বিষয়ে কথা বলার জন্য বা এই অঞ্চলে আমাদের এই সাউথ এশিয়ান অঞ্চলে যারা কাজ করছেন সেরকম দুজন বিশেষজ্ঞ আমাদের সাথে যুক্ত হয়েছেন। Ladies and gentlemen, we are very grateful that we have got two leading robotic surgeons with us today to participate in this discussion. First of all, I introduce Professor Dr. Pattara Kosanunt. He is Head Spine Surgery Department, Vejthani International Hospital. We also have Professor Dr. Anon Jaionnom. He is Head General Surgery, Vejthani International Hospital. And we are very grateful and very happy to have Ms. Zhigunova, Masha. She is Manager International Marketing, Vejthani International Hospital, Thailand. We warmly welcome all of you to this discussion.
Yeah, it's our pleasure to be here.
It's our pleasure to be here.
Thank you so much. So as we have decided that we'll talk about the modern robotic surgery in treatments. You are already leading surgery in spine, you are doing in abdominal surgery.
Yes.
But before going to the specialized area, very briefly I would like to learn about what is the overall status of robotic surgery in different diseases. It is now an integral part or it is still being integrated in modern treatments?
Nowadays, we can tell like most of the surgeries for the spine, we can using the robotics to help. Yeah, because basically about robotics, so most common question for the patients who come and ask like, what it will help us? What is that?
Yes.
What is like? Did it do all the surgery by itself or something? So actually, it's quite like the helper of the surgeons to do the operations more precise and easier to do and make it smaller. Yeah.
Okay. So if I translate it for our Bengali audience, it's like এখনকার সময়ে যেটা ডক্টর পাতারা কোশানন বলছেন যে যত রকম চিকিৎসা হচ্ছে বিশেষ করে যে সূক্ষ্ম সার্জারি যেটা হয় সেখানে কিন্তু রোবোটিক সার্জারি এখন অত্যন্ত গুরুত্বপূর্ণ পার্ট হয়ে গেছে এবং ডাক্তারদের সহযোগিতার জন্য এই সার্জারি এখন প্রায় বড় সকল হসপিটালগুলোতেই ব্যবহৃত হচ্ছে। If I ask a very quick follow-up questions, in your case, you are a spine surgeon, leading a spine surgeon in Thailand and have used this robotic surgery, integrated it in your practice. So what are the different conditions that you treat with robotic surgery in your practice?
Basically about robotic surgery for the spine surgery, it's helpful when we're going to put some implant, like some pedicle screws or artificial disc or anything to the patient's spine. So the robots help to guide us about proper positions, the way, the directions of each implant, which is making more safety and like more precise.
More precise.
Yes.
Okay. We'll learn more about different conditions that you treat, but we'll move to Dr. Anon. You are head of general surgery, but you are heavily involved in abdominal surgery and you are applying robotic surgery into your practice.
Yeah.
What are the different conditions that you treat with robotic surgery in your practice?
Okay, so nowadays that the most common that we face in our abdominal surgery is the first of all is hernia. Like
yes,
the hernia that recurrent from like the traditional surgery that the patient underwent the inguinal hernia, like to do the open and then it's come back again. So it's very complex and because they treat it already, but it's recurrent. So the robotics is helped a lot because of it is have 3D visualization and we can do complex the operation with smaller incision. Yeah.
Okay. So you call it minimally invasive in that case?
Yeah.
Okay.
Yeah. But it's different from the
Laparoscopic surgery.
yeah,
or
exactly.
anything.
For in the past we have laparoscopic, but laparoscopic is not 3D, and it's not like the angulation of the laparoscopic is very limited. It can do it simple case like appendicitis or even like simple gallstone disease. It can do via laparoscopic, but in like complex case like recurrent hernia or complex ventral hernia, the robotic helps a lot, because in the past, if the case like this, we have to do traditional open surgery.
Okay,
Yeah.
that's great. Thank you, Dr. Anon. So দর্শক আমরা যে ধারণাটি পেলাম এখানে ডক্টর পাতারা উনি স্পাইন সার্জারি, তার মানে আমাদের মেরুদণ্ডে যখন সূক্ষ্ম কোনো সার্জারি দরকার হয়, বিশেষ করে কোনো ইমপ্লান্ট দরকার হয় আমাদের মেরুদণ্ডে বসানো, তখন মূলত তারা রোবোটিক সার্জারি করেন। ডক্টর অ্যানন যেটা বললেন যে হার্নিয়ার যেই জটিল হার্নিয়া অপারেশন যখন দরকার হয়, যদি কারো হয় যে রিপিটেড দরকার হচ্ছে, একবার করলো কিন্তু আবার ফেরত আসলো এবং সেটাকে আবার আরও কমপ্লেক্স একটা সিচুয়েশনে জটিল অবস্থায় পৌঁছে গেল, তখন তারা মূলত রোবোটিক সার্জারি ব্যবহার করেন। এবং এটি তিনি বলছেন যে ল্যাপারোস্কোপিক সার্জারি যেটা, তার তুলনায় কিন্তু রোবোটিক সার্জারিটা একটু ভিন্ন, এবং কারণ এখানে একটা 3D একটি ভিজুয়ালাইজেশনকে তাদের করা হয়। আমরা একটা ধারণা পেলাম, আমরা আবার আসবো তাদের সাথে এই আলোচনায়। নাও আই মুভ টু Masha, to you. So you were looking at the different facilities that's developed in Vejthani International Hospital. How new is this introduction of this robotic surgery in Vejthani?
Actually, it's not that new, because in Vejthani our main concept is we always follow the innovation, because usually innovation is the best thing for the patient.
Yes.
And with the skill of the doctor alongside with the innovation, so we have the most precision in that. And therefore we have to find every single aspect of innovation and bring it in and train. So for us, as soon as any type of innovative technology or anything comes out, our hospital is actually the first to grasp it in Thailand.
That's very good.
Yeah.
So that means even in robotic surgery, there are generations of robotic surgery.
Yeah.
In the earlier
Yes.
stage, we had some probably the preliminary development, and now the advanced surgeries are now available in your
Yes.
hospital. Okay, that's very great. I think we also get a lot of patients from Bangladesh, and we'll talk about that probably in
Yeah.
later part. I hope that all of them have very good experience there. But before that, Dr. Pattara, if I come back to your area of expertise, spine surgery, what are the different type of problems, different type of medical conditions that you treat with robotic surgery?
So basically about the patients who need to put some implant in, so it's range from the patients who come with the deformities. Like for young patients who got scoliosis, we can use robotics to help to put screws, because we have to do some spinal fixations and straight up their spine.
Okay.
So first is about the patients who got deformities, the patients who got degenerated problems. So we have to fix their spine, put some artificial disc. So the robotics also helps. Yeah, and the patients who got trauma also, because some patients they broke their spine, and we have to fix their spine. So any kind of operation that we got to put implant, or in the patients who got some kind of cancer.
Yes.
So the bone become weak. So when we have to stabilize the spine, we have to put something in. So robotic also help.
Okay.
Yes.
In case TB, probably, because TB is
yes.
also something
Yes.
that affects the
Yeah,
the
because
spine
the
sometimes,
TB when
anything
the
that
patients-
affects spine, you
Yeah.
can, and you need
Yeah.
implantation, you can
Right, correct.
use robotic
So
surgery.
any kind of patients who need some implant, so yeah, we aiming to use robotics, because we know that it's way more safety for the patients.
Okay. Thank you so much for shedding light on that. Dr. Anon, in your practice, as you are applying, as you mentioned that some complex hernia or
Yeah.
other conditions are
Yeah.
treated with, what is the recovery rate? Is it adding advantage regarding recovery time, or is it the patients are having less sufferings during the surgery? What are the main advantage that this surgery provides when you take a robotic surgery approach?
When we compare this case, the complex ventral hernia and the complex hernia case, in the past that we have to do the traditional open surgery is way different. It's
Okay.
like the shorten of the hospital stay and the shorten of the recovery time is like from 1 week into 2 or 3 days.
Okay.
So that is game changing in the complex ventral hernia case. Yeah. Because we didn't get a chance like this in the past. We have to open the patient up and like fix it. Yeah. But nowadays we move into the robotic surgery, smaller incision, quicker recovery, and shortened hospital stay, and also like minimize the cost of the
Yes.
patient.
Yes,
Yeah.
that's a big
Yeah.
question from the
Yeah.
patient's
Yes.
part, whether it's more expensive or less expensive.
Yeah, yeah.
So
Even though
it's-
it looked like more expensive in the past, but
Yes.
if you like looking in the bigger picture, it's safe and like it's cost effective than the
Okay.
past. Yeah.
And as a surgeon, you before you used robotic surgery, you used those conventional methods to do those operations. Okay, but now did you train yourself to learn this, or what is the technological shift that you had to go through to apply this robotic surgery to patients?
Yeah, I have to train a lot in the first period that the technology come in, and training internally and go abroad and get the certification and come back and practice with my mentor.
Yes.
And after that, I can do it myself.
Okay.
Yeah.
Very good point. So, Masha, the reason I asked this question is it also gives kind of an ecosystem that you have within the hospital to introduce your doctors, best clinicians to the best techniques. So, how common is this? What's the ecosystem of introducing new techniques with the doctors, and what are the training facilities that you have available there?
For all our doctors, if there is something that is innovative,
Yes.
they will go abroad first to learn, to do the training, to do the certificates. So there's a whole program that they have to undergo. Only when they are finished with that program and have received the proper training, then they're able to come back and train further in with their mentor. And then only then they will do for the patients. So it's like a full setup, so they know exactly what they're doing.
Yeah. Okay. So in your case, the progress that you have seen in this particular robotic surgery in your hospital, what is the patient's response? How they're responding to the? Do you have any survey, follow-up questions with them, discussions with them, and they're saying, well, it is a miraculous development? What's the
Actually,
general thing?
most of the patients, we don't even need to follow up with them, because what
Okay.
happens is once they're done,
Yeah.
they were so scared of the surgery, and they thought, because of course for every patient, whether it's abdominal or spine, it's such a big fear, like, am I going to be okay? And then the next day, they're fine, because the accuracy is 99%. The pain is a lot less. It's value for money, and they feel fine, and they're not scared. They wake up and they're like, oh, what
Okay.
was I afraid of? There's nothing, you
Yeah.
know, I feel good.
Okay.
So we've noticed a very significant positive response from our patients post-surgery. Yeah.
Yeah. So does it mean that apart from spine surgery or say abdominal surgery, there are also other areas where you practice robotic surgery?
Yes,
in
like
Vejthani?
gynecology
Yeah.
and urology and cardio. There's many, so it can be applied in different concepts, because as Dr. Pattara mentioned before, it's a tool to help the doctor.
Yes.
So as many departments as we can use it in, it's the beneficial tool for the patient, you know, for faster recovery, less pain, and shorter time of stay and everything. So of course we will apply it to everything.
Okay.
And we do apply it already.
Very, very good
Yeah.
point. Thank you, Masha. Dr. Pattara, so when patients come to your clinic, they see you and they get the idea that, well, they will be operated with the help of a robot or something. As Masha said, it's a big fear for everyone who is going through a surgery. So how do you prepare the patients, and what are the general questions they ask when they are preparing for the surgery? And when you explain, what becomes their response?
So the mostly first questions for most of the patients, they're like,
Yeah.
do I really reach the level that I have to do operations? They're trying to run away from the operation,
Yes.
actually. So first of all, we have to explain to them very, very clear about the situation, why we need operations. And then we're going to explain about the way that we're going to do operation, what exactly what we will do during operations. And with the help of the robots, what about the benefits of it? How about the risk? How about the precise of the operation? So basically, when we explain to them about these whole things, so they understand like, okay, they really need operations, and operation is not that scary.
Yeah.
And yeah, basically we can tell them about like recovery in general. Like
Yes.
in the next day when you wake up after anesthesia, you can start to sit, stand, and even walk. So when we know about that kind of thing, because sometimes the pictures in their mind is like, oh, after operation they're gonna stay in bed for like a week, 2 weeks, they cannot move,
Yes.
or even they
That's
like,
the general idea. that-
yeah. So now everything is changed. So when we can explain to them very clear about what we will do and what gonna happen to them, so most of them feel relieved.
Yeah.
Yes.
দ্যাটস ভেরি গুড। দর্শক, আমরা যদি একটু ছোট করে বলি যে এতক্ষণ যে আলোচনাটা হলো, সেখানে কিন্তু আমরা রোবোটিক সার্জারির যেই সুবিধা সেটা সম্বন্ধে একটা বেশ ভালো ধারণা পেলাম। আগে যেসব সার্জারির পরে প্রায় 7 দিন বা 2 সপ্তাহ পর্যন্ত থাকতে হতো, আমাদের যেটা হয় যে আমরা ভাবছি যে একজন লোক একেবারে বেডে শুয়ে আছে। এখন দেখা যাচ্ছে রোবোটিক সার্জারি অনেক বেশি প্রেসাইজ, অনেক সূক্ষ্ম, এবং সার্জারির পরে যখন জ্ঞান ফিরে তার কিছুক্ষণের মধ্যেই হয়তো লোকটি সচলতা ফিরে পাচ্ছে, কিছুক্ষণের মধ্যে সে কেউ হয়তো হাঁটতেও পারছে। তো অনেক মিরাকুলাস একটা ডেভেলপমেন্ট কিন্তু আমরা দেখছি যেটা রোবোটিক সার্জারি থেকে এসেছে। এটি নিশ্চয়ই একটা আশাবাদের বিষয় আমাদের রোগীদের জন্য যাদের বিভিন্ন রকম সার্জারির প্রয়োজন হয়। ডক্টর অ্যানন, so when we think about surgery, there is, if we consider like the classic cinemas, we think about surgical theater, there are doctors like aprons and scalpels, a lot of instruments, small instruments. But what is the current scene of a theater when you are doing surgery with robotics? What are the different changes you see there?
Oh, it's totally different now. It's like the bed of the patient.
Okay.
And you have the robotic, the arms of the robotic that enter into the abdominal of the patient, and their arms is like hands.
Okay.
And in the other side of the room, we have console.
Okay.
With the surgeon is sitting in the console and have like 3D visualization.
Okay.
And it's like when you control, it's like the arms like inside abdomen of the patient.
Okay.
And we control like in the other side of the room. Okay. And the arms like movement like our hands.
Okay, so with the patients, as I said previously, the patient will be surrounded by many different people. The people's number now reduced in the beside the patient. It's mostly controlled from another room.
Exactly.
But what are the other supporting staff that you need when you do this surgery? What are the team members and the team compositions look like at this point?
In the field, I have one assistant in case of the equipment of the like obstruct or any problem with the equipment, so that my staff can fix it right away. And we have a nurse that assists at the field also. Okay, so that is just only like 3 people, and the anesthesiologist, and we have like the nurse support our field. And that's all.
Okay.
Yeah, it's very like
very neat now.
convenient. Yeah.
Okay, that's very nice. It's a different scenario at this moment, I would say.
Back there in the traditional open surgery, you like 1 surgeon, 3 assistant, and 2 nurse, and the other nurse is support in the outfield. So that you use like 6 or 7 people in the theater.
Yes. Now that scenario has changed completely. Masha, regarding this facility development, so it looks like the hospital that, how old is Vejthani hospital?
It's 30 years
30
old.
years. So
Yeah.
obviously 30 years ago or in the beginning, the facility was different, and now you have all these modern
Yes.
equipments. So how quickly the hospital adapt to these changes, and what are the mechanisms of operations within the hospital? So as I said, you need operational change, you need policy change, you need infrastructure change. So how do you manage those things?
It's everything, because we have so like I said, as soon as the world changes, we change. So whenever there's a new technology,
Yeah.
we get it. So we have to train not only the doctors, we have to send the nurses for training.
Yes,
So
yeah.
the nurses undergo a program. Then the team who's responsible for taking care of the patient, they have to also receive training, because they have to understand not only the nursing, because let's go back to the fact that we're an international hospital and many patients are coming from abroad, right? So we actually have a team of international coordinators, which is basically like a translator and coordinator to help assist the patient in every step. So that team also needs to know all the steps in order to be able to explain, because that is the team who will manage the patient from the day of their arrival to the day of their departure. So they're also trained, our doctors trained, nursing trained, all the policies are put into place, the equipment is checked.
Yes.
So there's multiple different things that need to be undergone in order for this to be a success.
Yeah, and that
Yeah.
that needs a significant investment, not only just money but also
Yes.
thinking
Investment in time,
Yes.
money, and training, and people,
Continuous
and
innovation.
finding the correct people, putting the right person in the right job.
Yes.
Yeah.
I will come back to you later in later cycle to learn about what's your view about this innovation cycle and how we can also do some in Bangladesh. So we'll talk about that. But before that, Dr. Pattara, so the different type of treatments that you mentioned, you talked about any kind of implant that we need with robotic surgery is very good. But if there is there any case where the condition was completely untreatable, but because of this robotic surgery now it's also treatable and you get very good outcome? Is there any particular case like that?
Yeah, because sometimes in the past with the conventional surgeries, some operation is very risky.
Yes.
So yeah, sometimes we cannot do it with like some old styles, right? So, but with helps of robots and also like help of like the whole technologies, because it's not only robotics for the spine. It's not only robotics. We also have like endoscope. We have neuromonitoring,
Yes.
which is all these things when we use it all together. So some operations that in the past we may have to avoid it. Actually, we can do some operation in the past, but the risk, it will be like very, very high risk, which is after consult with the patients, they're not aiming to do it. But with the help of all these technologies, so it's make the operation is more safety. So the risk when it's very low, so we can do that kind of operations. Yeah.
And also, is it the case that, for example, old people at one point they became so fragile that we want to go for operations, but because of this less severe consequence, you can now also bring those people on operation?
Correct.
Spectrum?
Because about the operations, when we can do it like in minimally invasive ways.
Yes.
So the injuries is less, the blood loss is less, the operating time is less, so they can be able to operate it. And also with helps of the whole teams, because only the surgeon is just one part of the team, right? So we have like the specialists for each field to take care of the patients, also cardiologists, endocrinologists. So everyone work together, so make the patients become as fit as possible, so we can do operations safely.
Yeah. Now, even when you were introducing the whole field, you talked about like the people who have some deformity issues, even children to oldest people. Now the spectrum is very broad, that we can say, because of the robotic surgery. Dr. Anon, from your practice and the development I see in this field in general, what are the future expansions you expect into this field, where we are heading to?
Okay, so we are now actually we're trying to do the robotic surgery as our usual practice, implement from the complex into like the simple case also.
Yeah.
Because in the future, yeah, the laparoscopic going to be less and the robotics going to be more and more. And it will help a lot in the in greater of the precision and also the cost effectiveness. Okay, and I think in 5 or 10 years, it's going to be only robotic that survive.
Okay.
Yeah.
Wow, that's a big transition, isn't it?
Yeah, exactly.
And as you mentioned in the beginning, that it's nowadays it's mostly the arms that you control from a console.
Yeah.
But do you think in the future it will be more involvement from the robot? Like they also make decisions. The console is also regulated by the robots, because we are now in the post AI age where AI is also making lots of decisions and integrations into this field.
I think in the aspect of the surgeon, I think mostly full control by console surgeon, but AI gonna assist in like
decision making.
Yeah, decision making. This is a vessel, or this is a nerve, or something like this.
Okay.
Is like helping us, but the main console still human, still surgeon. And in the future, if we have like the robotic in Dhaka, and we control from the Vejthani, it's possible.
That is the possibility.
Yeah.
So
it's the way of the future that we are heading to.
Yes, So geographical distance will not be a matter anymore.
Yeah.
From one country, we'll be able to operate another.
Yeah, exactly.
That is going to be big contributions in this field.
Yeah.
That's a very good point. I'll come back to this probably as a concluding remark. But before that, Masha, as I mentioned, in Bangladesh, you come to Bangladesh quite often. You said in our background discussions for 15 years you've been visited. You have also seen the developments of this health sector in Bangladesh. In your opinion, if we want to integrate these latest technologies in Bangladesh, how we should move from public sector and also to private sector?
I think mostly this would be in the private sector primarily. So you have to set up the same kind of training that we have and the same kind of system. So what we can do is, for example, we can do partnerships between Vejthani and Bangladesh and various hospitals that would be interested to work with us in order to provide information for them on how we did it. And at the same time, they can also teach us what they're doing here, because there's many things because here the doctors are very good. It's just that the technological aspect, the innovative aspect is not yet that available to the doctors here, right? But in Thailand, it's more focused on the innovation. So the doctors have more chance to learn. So it would be a good opportunity to combine the two. And then, as we said, because in the future, we don't have to be in one country. We can be operating from there, and even your doctors could be operating from here to our patients. We don't know. It could be an exchange of knowledge, exchange of, it's a multidisciplinary team, which can be a cross-border multidisciplinary team. With innovation and technology.
Thank you, Masha. দর্শক, আমরা যদি এই আলোচনাটুকু একটুখানি সামারি করি আপনাদের জন্য, যে রোবোটিক সার্জারি কিন্তু অনেক উন্নতির দিকে যাচ্ছে এবং আগামী 8-10 বছরে ডক্টর আনন যেটা বললো, যে আমরা কিন্তু ইতিমধ্যেই দেখছি যে এক দেশ থেকে একজন সার্জন অন্য দেশের রোগীর উপরে অপারেশন করছেন এবং সেখানে এআই এসছে, এআই আরও বেশি সক্ষম করবে আমাদের ডাক্তারদের। কিন্তু আমরা যদি সেটাকে বাংলাদেশে আরও বেশি সহজলভ্য করতে চাই, তাহলে মাশা যেটা বললো তার এক্সপিরিয়েন্স থেকে, ভেস্তানি হসপিটালে তারা যেভাবে টেকনোলজিগুলোকে ইন্টিগ্রেট করেছে, আমাদের দেশেও কিন্তু আমাদের ডাক্তারদের কোয়ালিটি কিন্তু খুবই ভালো। সুতরাং আমরা যদি তাদের জন্য এই প্রযুক্তিগুলো সহজলভ্য করতে পারি, তাহলে কিন্তু এবং কোলাবোরেশন করতে পারি, ইন্টারন্যাশনাল কোলাবোরেশন, তাহলে হয়তো আমাদের ডক্টরদেরকেও আমরা এই প্রযুক্তির আওতায় এনে আমাদের রোগী এবং তাদের ইন্টারন্যাশনাল এক্সপোজার যেটা, সেটাও কিন্তু বাড়ানো সম্ভব। We are almost about at the end of the program, but before closing, Dr. Pattara, I would like to get some of your insights about the experience that you have in Vejthani Hospital. You have also seen lots of Bangladeshi patients there. Lots of renowned people also visited your hospital, your patients. So how do you see the prospective knowledge transfer, technology transfer between Bangladesh and Vejthani Hospital or other international hospitals in Thailand or within this region, not just in Thailand, in Singapore, Malaysia, and China, all of them are doing very good. So if we want to move regionally, what would be your suggestion?
So for my opinion, because we got many patients who like coming for consultations. As Masha mentions, like the doctors here, they are very, very good. Yeah, but the point is sometimes they don't have some equipment, some technology that's still not available here. So the part that we can help is also like we can recommend something that they don't have it here. So the patients can receive it back there, or if some of the treatment that they can also complete here in Bangladesh. So we're willing to work together with the doctors because we know that the patients cannot like stay for long term in Thailand, right? And also, so we love to working together. So as a team, the doctors here, the doctors in Thailand. So something that we have, we can provide for the patients. Something that they already have it here, so it will be more comfortable for the patients to do it right here also. Yeah.
So the Doctors Without Border, it becomes a big reality now. Technologically, we can obviously make those impactful collaborations.
Yes.
Thank you so much, Dr. Pattara, Dr. Anon, Masha. Thank you so much for sharing your insights. It's a very exciting area, and as a country, we will also be very willing to move to the direction. And I hope that with the connectivity and the kind of collaborations that options that you have mentioned, we all will be benefited. Our patients at the end will be benefited from these technological advancements. Thank you so much for your time.
Thank you very much too.
Thank you.
My pleasure also.
Thank you. দর্শক, শেষ করছি সুরক্ষায় প্রতিদিনের আজকের এই বিশেষ আয়োজন। আমরা 3 জন বিদেশি অতিথি পেয়েছিলাম। তারা তাদের দেশে থাইল্যান্ডে ভেজথানি হসপিটালে তারা কাজ করছেন। তাদের যে অভিজ্ঞতা, তার আলোকে আমরা বাংলাদেশের প্রেক্ষাপটটাও কিন্তু একটুখানি জেনে নিলাম। তারা প্রত্যেকেই বলেছেন আমাদের এখানে ডাক্তার যারা আছেন তাদের কোয়ালিটি সেটা কিন্তু অনেক ভালো, কিন্তু আমরা টেকনোলজিক্যাল যেই জায়গাগুলোতে একটু পিছিয়ে আছি সেটা যদি আমরা এই আঞ্চলিক সহযোগিতার মধ্য দিয়ে, কোলাবোরেশনের মধ্য দিয়ে আমরা যদি এগিয়ে নেই, তাহলে কিন্তু শেষ পর্যন্ত আমাদের যারা রোগী আছে তাদের জন্য অত্যন্ত ভালো কিছু সুবিধা আমরা ইন্ট্রোডিউস করতে পারবো। এবং সেখানে তারা অলরেডি বলেছেন যে ভেজথানি হসপিটালের সাথে যদি কোনো রকমের সহযোগিতা দরকার হয় সেটার জন্য তারা প্রস্তুত আছেন। আশা করি আমাদের দেশে যারা সিদ্ধান্ত নিচ্ছেন আন্তর্জাতিক কোলাবোরেশনের মধ্য দিয়ে আমরা একসাথে এগিয়ে যাব আমাদের রোগীদের সাথে স্বাস্থ্যসেবার উৎকর্ষের স্বার্থে। সেই আশাবাদ রেখে আজকের মতো শেষ করছি।